So, good morning, Miss. The topic that we are going to present today is the health crisis. So, the group member that we have is me, Kelvin Pak, Lim Jin Yan, Lee Sao Kwan, and Lee Yong Hao. So, the first point, I will pass it to Queenie.
Thank you, Kevin. One of the health crises that emerged or became serious during the COVID-19 pandemic is depression. It was found that the depression rates were many times higher during the COVID-19 lockdown compared to before the pandemic. Due to the COVID-19 lockdown, it has affected in the economic downturns. In order to stop the spread of this virus, people are being restricted to go outside, such as dining in the restaurant, shopping, and traveling. This has eventually affected the business operation of the company, as the company do not have sales to cover the expenses, and some of them are being forced to close down. This issue causes the retrenchment in the company, and many people are feeling job loss. However, income is not the only factor that causes depression. Social isolation is also one of the contribution factors to people of all socioeconomic backgrounds. People are more socially isolated as they have been months of social distancing and sheltering at home. Being cut off from the love, support, and close contact of family and friends will trigger depression or make it even worse, as they will have to face the problems like stress, anxiety, and isolation on their own. Furthermore, uncertainty about the future will also lead to doubt and negative predictions. There are people who wanted to start a business, but due to the financial hardship, it has been delayed for months. There are also people who are facing a sudden loss of a family and friend due to the COVID-19. This can cause depression as they are unable to predict what will happen during this pandemic and when will this pandemic end. These reasons will lead to insomnia because people may be having too many thoughts in their mind that causes them unable to have a comfortable and peaceful mind. Also, being too stressful and feeling hopeless will lead to suicide. So, how do we cope with depression? As people are being stressed out during this pandemic, it is advised to do some meditation. Meditation is an effective calming technique at times of high stress. A regular practice of meditation will help the brain better manage stress and anxiety that can trigger depression. Next, it is also important to have a healthy lifestyle. Sleeping too much or too little and skipping exercise and daily meals will only feed into your depression. Having a better sleep and meals will result in having a better concentration to work on the things that we are able to control. Moreover, talking with family and friends can help in expressing yourself. Family and friends are able to help you if they know you are in difficulty. Sometimes, the person you talk does not even need to come up with solutions. Just by expressing your thoughts or difficulties, it can also help to relieve stress. Thank you, so I'll pass it to Kelvin.
Thank you, Queenie. So besides depression, obesity are one of the healthy crises as well. Since the pandemic began, dozens of studies have reported that many of sickest COVID-19 PNTs have been people with obesity. So it showed that 77% of nearly 17,000 PNTs hospitalized with COVID-19 were overweight or obese. It is because people who having obesity will weaken their ability to fight against the COVID-19. Besides, obese may hampering the immune system's lung function and also causing inflammation. So that obesity are listed as one of the serious crises after the COVID-19 pandemic occurred. Comes to the effect, having obesity may triple the risk of hospitalizations due to the COVID-19 infection. Based on obesity, review had shown that people with obesity contracted several acute respiratory syndrome coronavirus 2, which is called SARS-CoV-2, were 113% more likely than people of healthy weight to land in a hospital, 74% more likely to be admitted to ICU, and 48% more likely to cause death, which means obese PNTs are in a more dangerous situations compared to normal PNTs who infected coronavirus. So here comes to the solution. According to the Obesity Review 2020, shows that there are people trying to develop a new therapies to against the coronavirus, especially for obese PNTs who infect coronavirus. By understanding how these therapies work in the host with obesity is critical information to determine their long-term effectiveness. Apart from this, the second solutions are more natural solutions without any medicines. To avoid obesity crisis could be said as having a healthier diet meal schedule. By planning an effectiveness schedule will allow them to follow the schedule and make sure that they won't simply eat others unhealthy food or junk food as well. But the most important thing is obese PNTs is that they need to have the perseverance to lose weight as well. So thank you. That's all for me. Next, I'll pass it to Gordon.
So moving on to the next health crisis, which is burnout among global healthcare workers. So the World Health Organization, WHO, recognized burnout as a global health crisis that affects countless of people, especially in the medical field, such as our physicians, nurses, and also other healthcare providers. And also due to the extraordinary demand on healthcare workers, they really do face long working shift hours, and often with a very limited medical resources, and also with the need of wearing personal protective equipment, that may cause physical discomfort and also difficulty in breathing. So as the day goes by, the alarming rise of COVID-19 cases can actually lead the healthcare workers to isolate themselves from their family. And the reason of that is because they feel psychologically distressed, such as the fear of transmitting the virus to their family members. And besides that, they also have to constantly switch up their routine because they have to prepare to work at literally any time. And lastly, they also have to narrow down their social support network, such as meeting face-to-face with their friends or even visiting them. And according to various medical survey studies, researchers have come to a conclusion that, among every 3 healthcare workers, 1 are very likely to experience burnout, physical and mental health, mental stress, which can definitely further influence their professionalism and also efficiency in the workplace. So with that being said, the effects of burnout are pretty alarming. So the very known consequences of burnout are decrease in job satisfaction, second, mental pressure, and lastly, very high potential for employee turnover, which ultimately will create another major problem, which is lack of frontliners. So last but not least, there are of course some of the ways to kind of cope with the burnout and simultaneously reduce the chances of getting burnout. So self-care is exceptionally important. So the very first self-care tips is to definitely attend to the basic, which means that you need to practice healthy diet and do regular exercise. Exercise may seem like a very little thing, but research has been shown that exercise increases the level of endorphin, which is a mood lifter. Basically you feel a little bit better. So the next tip is to take small breaks throughout the work. So during the break, an individual may look for distraction, such as calling your family members, connecting with friends, to talk about non-work related stuff. And the third tip is to set up a good sleep schedule and cutting down on caffeine. So sleep is significant in reducing the burden of stress and also encourage the body self-repair. So an individual can be physically and mentally prepared to head on to the work and be efficient during work. So the last tip is to definitely seek for professional support, like the mental health practitioner. So an individual is able to go through a more advanced therapy to cope with the existing burnout. So we will move on to the next health crisis.
Okay, thank you, Yonghao. As mentioned before, the pandemic has hit the world since more than a year now, and everyone is forced to stay home. Since then, an article from Medical News Today has explained that the limited social interactions during this pandemic has resulted in feeling of isolation and constantly being consumed by the loneliness. These negative thoughts then eventually lead to social anxiety. People who are diagnosed with this mental illness often find themselves getting too used to spending time alone for a long period that unknowingly has lost the ability and courage to face social interactions again. Thus, it can be extremely difficult for them to adjust back to their normal social life. As a matter of fact, drastic reduction in exposure to in-person social situations is one of the biggest factors of causing social anxiety to occur. After understanding the main factor of social anxiety diagnosis, what kind of effects that can be seen in a social anxiety person? Well, apparently, one of the most common effects is constantly feeling threatened when they encounter social situations after a very long time isolating themselves. This is because social anxiety is actually a threat response. In this situation, it will trigger uncontrollable alarming emotions such as feeling worried, anxious, and panic. The following effect is being hyper focused on oneself while in the presence of others. According to National Social Anxiety Center, uncomfortable intrusive thoughts such as hyperfocus could hone in one's speech, physical presentation, dress, posture, anxiety symptoms, and just really anything. In the meantime, it also intensifies one's self-consciousness due to not being able to distract their focus from themselves as we speak. So how do we face the society again while dealing with social anxiety during this tough time? Arlene from Very Well Mind stated that the first thing you can do to overcome it is to try and make a point to leave the house every day. For instance, force yourself to go out for a small walk around the neighborhood, or if you are living with roommates or family members, be the one to get groceries. It will help with social interactions with people after all. Secondly, you can also try and socialize with people as much as possible, such as talking on the phone, communicating on social media, and video calling family members and friends. Doing this will prevent emotions being bottled up. Next, there are a few ways to cope more efficiently with social anxiety disorder. Having a journal and constantly writing down every thought in order to know beforehand how to react to things that will trigger your anxiety. Furthermore, deep breathing exercise such as the 4-7-8 breathing technique can help to reduce anxiousness. This technique is super easy to do so. Other than that, you can find something relaxing to do to soothe yourself, such as watching funny shows or using a mental health app. The app can help to track your daily progress and provide visual insights and actionable exercises to be a reminder for keeping you on track. In brief, it is super okay to be awkward and when encounter physical interactions in such a long time. It is vital to make yourself feel comfortable and safe around people because your feelings and mental health always come first. Your emotions are always valid and no one should tell you otherwise. And it is also fine to acknowledge anxiety and take as much time as you need to complete any task that needed to be done. And that's it from me. Thank you for your attention.
So here comes to the conclusion in general that the point that we have present is the depression, obesity, burnout among global healthcare workers, and also the social anxiety. So that's it from us. Here I also have some reference. Thank you, Miss.